Welcome to another episode of Marketing Tips for Doctors. I'm your host, Dr. Barbara Hales, and today we have with us Dr. David Rominsky. Welcome to the show.
Thank you for having me. I appreciate it.
There's a dirty secret in healthcare that nobody talks about. A packed waiting room does not mean a profitable practice. Dr. David Rominsky spent over 25 years figuring out why, first as a clinic owner, then as the founder of Doctor Referral Institute. He works with healthcare practices across multiple specialties, helping them build referral systems that consistently bring in the right cases, not just more cases. Well, let's get into it, Dr. David.
Sounds good. Thank you for the intro.
How is it that you decided upon doing this referral system? What got
Yeah,
you into that?
yeah, it's a good question. So actually, it's in my own practice. So this is back early, probably, I don't know, probably 25, 30 years ago. We were working on getting into a publication that was pretty popular for our demographic that we were looking for. And we finally got into this big publication. It was actually called Suburban Women. It went to probably about 80,000 women household in the area who was a big target for our practice. So we ran the ad and we'd met every week with our team and that I'd had working for me. And so the phone was ringing off the hook and I asked my office manager, so how's that new ad going? And she said, it's going awful. I go, what do you mean the phone's ringing off the hook? She's like, yes, we've had tons of phone calls, but we've really only had two cases that are really what we want to see. Not only cases are appropriate, but also on the business side, the appropriate payer mixes. So I was pretty frustrated. So I'm like, okay, well, everybody take your top 10 favorite patients, right? No matter who they are, don't share them with anyone else, whoever you love seeing and bring them back to us. Well, at the time, we'd had 8 people working for me, so there was 80 names. So when we sorted through it, of those 80 names, 62 of them were the same people. 62 were the same people everyone loved to see. So I'm like, well, that's it. Let's find out where they came from, right? If everyone likes to see them, everyone from the front desk person to the assistants to the billing people, they all love those people. Let's focus on that. So when we looked and we reviewed it, we found out that 58 of the 62 people were actually referred to us by other healthcare providers. So if that is the case, I'm like, well, wait, this is obviously a big deal, right? We need to go after that. So that's what we did. We worked on it for a few years to figure out how do you build a relationship with a referring provider that creates value for them and value for their patients, because frankly, they don't care who you are. They want to know what you can do for them, right? So we worked on that, got really good at it, sold my clinic back in 2010 and started Doctor Referral Institute. And that's exactly what we do for others around the country, is help fill their offices full of cases they're really good at, paid well for, to not only improve efficiency in healthcare, make sure patients are seeing the right providers, but providers are seeing the right patients.
Why do great doctors still struggle to grow even today, despite the fact that there is supposedly a shortage of doctors?
It's education. It's really what it is. It's education of not only, I guess, from the doctor standpoint of it's truly understanding the business side. Because if you think about it as a provider, we've always been taught, patients first, patient everything, which is exactly what we're talking about. We want to make sure patients are being taken care of. But on the business side, we need to take a step back and look at our actual practice, right? Because if you think about the person who walks through the door as an owner of the practice, whether it is exactly the case you want to see, or if it's something that maybe is not an appropriate fit for what you're doing, either condition or payer mix, you're the only one affected. Everybody else makes the same amount of money, right? Whether it's the front desk or referral coordinators or office managers or assistants or whatever else, everybody gets paid the same. You do not. So that's why they really got to take a look at the business side of their practice and understand where those people are coming from and what that looks like. And we know over and over again, it's the referring providers that are most important, and it's how to nurture and build those relationships, which is really essential in putting a system to that for their business.
What do referring providers actually base their decisions on?
Good question. And a lot of it has to do with people they know and people they can relate to, right? So we do have some people who will say, I do work on those relationships and we show up, every, couple times a year and bring something to them. Well, they see patients every week, right? And so every week they're seeing people. So we want to make sure we're staying on top of them and communicating with them. And the other thing is going to be is this, is that there's so much turnover in healthcare, just like anything else, that a lot of times that front desk or that office manager, or that referral coordinator, or that assistant, there's a lot of turnover. So they don't understand actually maybe the demographic of who they work with closely or who might be the best fit for that. So we want to make sure we can systematize that to create that value for them and make sure they're for a referring provider that those patients are being taken care of, right? Because that's what they care about. Are you going to take care of my patients? And if something doesn't go right, how are you communicating back with me? And that's really what we want to be able to provide for them.
You've talked about the busy trap, why a full schedule doesn't mean a profitable practice. What do you mean by that?
Well, because if you think about it, that I'll give you a perfect for example. We had a client of ours that is going to retire in about 6 years. He said he wants to be able to retire in. And he says, right now in my practice, I have right around a 5 to 6 month or 5 to 6 week waiting list to try to get into me. Yet, if I actually looked at, because one of the assignments I gave him said, look at your practice and understand actually the demographics of it. And 35% of his practice is full of cases that are really not what he should be seeing, right? They're not really the cases that they want to see in their office. And not that it's wrong with them providing care, but just in the business side, they're not. So he's like, my practice is full, but I'm really not, being busy doesn't mean I'm actually making any money on what I'm doing on the business side of my practice. So that's where some of the issues are going to be is that you're filling up. And frankly, a lot of times too, patients a lot of times may not be seeing the correct provider for their case. And that's where education is such a big deal.
I see. Well, you also talk about how your best referral sources aren't sending you patients. That seems like a contradiction. If they're the best referral sources, how could they not be sending you patients?
Because they don't understand exactly who to send those cases to, right? So a lot of times this happens all the time, right? Where they may have the demographic that's perfect for you, but you've not been there in front of them to educate them on exactly what you do. So they just send them to whoever, right? Those are called splitting referral sources. They may send a few to you, a few to somebody else, yet you have the demographic and they have the patients that you want, but you're not there. There's no system to help build and nurture that relationships. And they happen to send just because versus thinking of you and you creating that top of mind awareness to them. So that's why that's so important.
I see. Well, how do you stop seeing the wrong patients?
Well, and the biggest thing is going to be is that first thing again is understanding what you want to see, right? And not so much that, but really the demographic is finding out, okay, what are you good at? Who has those cases? And then building and nurturing those relationships with those appropriate providers. And by being in front of them and building and nurturing those relationships, it allows you to make sure that you're able to create the more you ask for what you want, the more you're going to see what you want, right? So educating those providers on exactly what you want to see is really how you can drive the demographic. And it's not just getting patients in the door, it's converting the cases that you want to see. That's another big issue too, right? A lot of people, put a lot of money out to marketing and different things, but they get a lot of people through the door, but it might not be the right fit or they're not converting or following through with their care. And if they don't do that, what are we doing, right? And we know that a referred patient is by far the highest converting one.
Well, don't you have to see all of the patients that are referred to you?
Of course, you can't go in and not tell people not to come into your practice, right? You can't say that. But if you educate the referring providers again of, hey, guess what? This is exactly the case I'm looking for. The more you do that, the more you're going to see what you want, right? It's just frequently, it's an educational piece for sure. And that's why you ask for more of what you want, you're going to see more of what you want.
And do you have like you wash my back, I'll wash yours in terms of you referring patients to them as well?
No, we don't set that up as far as a reverse expectation for any of our clients because frankly, it might not be a fit. For example, if we're going to marketing for doesn't matter, let's say in the medical industry we're marketing a family practice internal medicine to send their cases to whatever our specialties we're dealing with, a lot of times that specialist is not going to have a bunch of cases to send back to them, right? It's just not the case. Most times they've come from them from somebody else, so it has nothing to do with that back and forth at all. If it happens to happen, that's great, but it's not something that's anticipated for sure.
Well, as is your name implying Doctor Referral Institute, that this is a situation that is more beneficial for the patients themselves than for the physicians. How do you get your name out there so patients as well as doctors know who to come to?
Yep, good question. Yeah, so all of our work that we deal with, we deal directly with the doctors themselves. All of our clients are specialists. So think of it, anyone in the medical or dental industry, does not matter who they are. If they can receive a referral, they can be a client of ours. And then when we go out, there's several different ways we work with clients, but one of our turnkey models, if our liaisons are doing the work for them, we would go out and then educate the referring providers on what cases are appropriate for them, right? And what we do is we basically charge, none of our fees are tied to referrals at all. We charge a flat fee for work and efforts that we do. It's not tied to referrals whatsoever. It's just charging on the relationship and what we're trying to build for them, right? So for them, by educating the referring providers on what we do, we have team members all over the country, right? We represent in 35 states right now that we go out and help provide solutions for them, right? That our team, who are previous pharma reps, device reps, experience in industry, go out for them, right? And build those relationships. We also have some who have their own team members who are like, listen, we have someone else who does this work a little bit and they try to do these things, or I have someone in the office that could go and do that. We have a full coaching program for them also. So we're able to implement our systems and process to help coach that person with our referral growth and profit systems to help them do what they're supposed to do, and then utilize our back office reporting, which we've customized to make sure they can see actually what's going on in the market. How are things going? What does the relationship look like? How do we make sure we take care of them? What else is needed? All these steps that the referring providers care about. And also you're going to care about as a client to make sure that we're able to build a true system for you, because that's what's really important.
Okay, so you come into an area that you may not have been in before as you're expanding, and you know, go to speak to the doctors. How do you get in? How do you get in the door? Or
Great question. Yeah. And remember, that's the number one question I get from everybody. How do you get in the door? Right? We've been there before, because you think about it, even in my practice, the gatekeeper's responsibility is to keep you out. Right? That's the number one thing, keep you out of the office, right? Well, one thing pretty important for us too is on the educational side, which our team is taught to do, and we coach people on doing also, is that we're there for the patients to make sure they're being sent to the right place. We are not there as pharmaceutical reps or medical device reps who are trying to sell something on that side. And there's nothing wrong with them. I have numerous ones that work for me. But what we want to do is on the relationship side, making sure that patients see the right provider. Now, the one thing to me too is I'll give you a little analogy here, and this happens millions of times a year. Let's say, for example, and this can happen in any space, but I'll give one that's pretty relatable. You're a weekend warrior. You go out, you do something, and you hurt your knee, right? So you go to your primary care provider and say, hey, listen, I hurt my knee. Provider says, yep, you got a knee condition. I'm going to send you to the ortho. So they write a script for you to go to the ortho office. You get in, however long it takes you to get into there. You go in and you see the ortho, and they say, yep, you got a knee condition. Issue is I'm the shoulder person, really focused on shoulders and other things. So I'm going to send you over here to my knee provider, my partner over here who deals with knees. Now, you as a patient, frankly, just wasted your time. You wasted your time, your money, your effort going and seeing a provider that's not exactly the provider that you should be seeing for your particular condition. The provider on the other side wasted their time also, right? Seeing you, taking the time in their schedule, that is really not the appropriate case to see it. Now, that happens millions of times a year. So if we're able to educate the referring provider on, hey, guess what? If you see knee condition, or you see shoulders, or fill in the blank, doesn't matter the specialty of what it is, right? Medical or dental, they can increase the efficiency in that care, making sure patients are being taken care of as they should, decrease the amount of time that's waiting for you to get that, saves you tons of time and money that you're doing as a patient, and helps the provider on the back end filling their book full of cases that are actually appropriate for them.
well, that certainly makes sense. Do you run webinars or any type of educational programs to attract prospective physicians?
Yeah, so we do different, all kinds of different items for that. We do different things, whether it's on social media items and different aspects of webinars. We also offer for any of them, which is pretty powerful, is a free referral evaluation, right? That's a big deal for us. So we talk to any clinic, doesn't matter, cost them absolutely nothing. 20, 30 minutes to learn more about them and what's going on to see if there's something that can provide a solution for them. Because everybody is very similar as far as what is needed, but everybody has their own nuances. So therefore, we go through the whole program, educating them on numerous different aspects of what might go on or what might look like to see if they'd be a fit, right? And where they're looking at. And the other thing that's pretty important for us too is that we offer exclusivities per specialties, so they don't have to worry about us marketing their competitor next door, right, for their particular thing, which gives them protection in the market to understand when we implement the systems, we can truly grow with them, which is a big deal for us also. That is something that I think that I can't emphasize enough for providers out there is free is a good charge, right? I mean, so we offer them free just to see if there's something that can help with because there's numerous different ways we can work with people and doing this long enough, it provides us opportunities to truly see what might be going on with them and truly provide a value for them, whether they work with us or not, to really provide that educational piece of what might be a fit for them.
Well, that certainly sounds extremely helpful. What about patients that can only go to certain providers based on their insurance
Yep.
participation? Does that enter into your service as well?
Absolutely. Yeah, that's part of the educational process, right? When we go to uh, potential referring provider, part of our evaluation, we do a condition of the month program to make sure we're educating them on what's going on. Part of that is not only identification of the cases, but also payer mixes also. We want to make sure that they understand exactly what our clients do and what are appropriate and what insurances, if they take insurance or if they don't, what that looks like. So yes, that's absolutely part of our educational process to the referring provider.
I see. So let's say you are considering having me as a client of yours. Uh, tell me, tell me what your spiel would be that would
Sure.
make me just say, you know, I have to do this. I mean, like David Rominsky is like, like, where have you been? You're like an
Right.
angel.
Mhm.
So what would you say that would make me feel that way?
Well, a part of different things is going to be is that understanding that we're not a marketing company that hasn't been there, right? I've been in your shoes, right? As far as a provider goes, to understand that nuance. One of the things we talk about on the referral evaluation is going to be is that for any provider, we're always educated on the patient side of it. But the business side of it is really not a big part of our education. So when we go into the first thing we do in a referral evaluation is talking about, listen, this is a business conversation. We understand you may not have all the answers, right, of what we're going to ask, but that's okay. But these are things that you need to know that we want to make sure you get to know. So one of the first things we're going to talk about is the identification of what are you good at, what are you paid well for on the business side of your practice. And you to be able to identify 3 to 5 cases that are really those that matter. That's number one. Number two is going to be is on the actual education on details of who's walking through your door. So what I mean by that is this. You should be able to pull a list of every patient who came through your door, who their primary provider is. Whether referred or not does not matter. You need
Mhm.
to know who those people are, right? Because either A, that's someone you need to thank for that referral, right? Or B, that's someone new you could potentially go after, right? To be able to do that. And for anything that gets results, it has to be systematized, right? You got to have a system to be able to do this. So what we provide and what we go and take a look at is give them options of a kind of a bronze, silver, gold type thing as far as what it would be to work with us. And they can't hire someone to do what we do for the price we do it for. So looking at being at the business side of our practice, also, I want to make sure we provided a solution out there that not only can help people drive the results they're looking for, drive the profitability of their practice, but also at a cost that makes sense, right? That can scale with them. So it's something we're very, very proud of. So we found out many times. A matter of fact, we just got done doing a big group 2 weeks ago that was like, where have you been? Right. I've been looking for something like this for a long time to be able to help my practice because I know I'm missing something. Right. And the thing that's going to be is a lot of, as they know, is the lead costs, right. And ad costs and Google Docs, and everything else is getting really expensive. Right. So they're looking for a solution that provide them repeatable results. Because if you think about on the repeatable side also, general practitioners, doesn't matter in medical, dental, whatever else, the average cases they usually see a week is 100 to 125. Okay. Well, then next week they see a new 100 to 125. And the week after, a new 100 to 125. So that is a very fruitful opportunity to make sure that you're getting the patients of people who may be seeing it that have exactly the cases you want to do. And we know right now that we're seeing about an 80% conversion rate on a referred patient. So meaning that they get referred, they're going to follow through with care. Those numbers are staggering compared to most that are out there. So that's why I think it'd be something worth definitely doing.
In getting to know all the doctors in a particular area, can you help a physician who says, you know, what what service is lacking that by taking it I would be unique, or what am I offering that is unique that nobody else is doing?
Yeah, absolutely. Yeah, we do look at that. So we have quite a bit of data as far as the market share goes. I mean, we don't have every provider in the country, but pretty close. And so we're able to take a look at also. I'll give you another, for example. We have a couple big franchises we work with too, right? That have locations all over the country. And part of it's going to be is listen, if you see an area that is void for what we do, let us know, right? And then they bring a location on there. So we do see that quite a bit. We can also talk about you'll see some areas that are overran with different particular specialties, right? That there's a bunch of them. You can't throw a stone with hitting fill in the blank, right? Well, a lot of times too, the void is the education of the referring provider on exactly what they do, right? That's where a big miss is going to be because they throw everybody under the same umbrella, which you may have a niche you're providing that is something that is absolutely scalable in that market, but nobody knows on the referring provider side of it too. So when we go out and build and nurture relationships with referring providers, part of it is really finding out not only what the referring provider has for patients, but what is the demographic? What does that look like? What are they really in need of? And listening to what they have to say is a huge value add.
Yeah, I think that may be one of your most valuable services.
Mhm.
Like as a practicing physician, like I know what I provide. I don't know really what
Mhm.
everybody else, in my specialty is
Is
providing.
looking for. Yep, yep. Mhm.
So just knowing that, it is tremendously helpful.
Yeah, absolutely. No, and it's big because if you think about it, the workflow of patients that's out there, right? They're looking, referring providers looking for a solution because they can't treat them. They got to go somewhere, right? So, and we all know too that there a lot of times they're graded on how well they refer out, how well they taking care of that patient on the backside of it. So we can help them on both sides of it and provide true communication. People want to do business with people they know and people that are in front of them, right? We get stuck in the digital age of emails and things, and no one's actually talking to people. Well, people want to talk to people, right? They want to be in front. They want to know who I'm sending to, put a face with that name type thing, which is really extremely valuable.
Absolutely. Well, this has been a wonderful conversation, and for all you listeners out there, who feel this is the service for you, how can they reach you?
Yeah, we have numerous different ways. So our website is referralsfordoctors.com. We also have here on the screen here this little QR code. This is for my referral evaluation. So feel free to schedule that referral evaluation. You can look at us at LinkedIn under Doctor Referral Institute. We're very accessible for those. And really our opportunity is we want to create value for you, right? To have a conversation to see if there's something we can help you with, and it costs you nothing to do so.
Well, that's great. Thank you so much for being with us today.
Thank you for the time, Doc. I really appreciate it.